Welcome to episode 7 of our video podcast. Today, we're going to talk about Medicare Hub Limited's convalescent care services. Stay tuned.
Hey everyone, welcome back. Today we're going to be taking a deep dive into convalescent care.
Ooh.
And I bet you've at least heard of that term before, but we're going to really kind of go beyond just the basics today.
Okay.
So convalescent care is not just about those long-term care facilities.
Oh, yeah.
We're really going to be focusing more on like how people can recover from, an illness or an injury in a comfortable setting at their home.
At home.
And we're going to be talking to, we're going to be learning all about Medicare Hub Limited today.
Okay, great.
And they have this unique approach to at-home convalescent care.
Interesting.
So let's just jump right in.
Yeah.
What exactly are we talking about when we say convalescent care?
Yeah, so it's really all about giving support for individuals who are recovering from a variety of things. So it could be an illness, it could be an injury, it could be a surgery. So it's that extra support that you might need when, maybe you're not quite up to doing all the everyday tasks.
So it's more than someone just coming in and like making sure you take your pills or whatever.
Yeah, you can think of it as like a bridge between the hospital and being, fully back on your feet.
Okay.
So it could be anything from, managing your medication, doing a little light housework, maybe preparing meals, even just being there for companionship.
Oh, right.
Which is, really important.
Yeah.
For mental well-being when you're recovering.
Imagine so, yeah. Now, imagine this. You are recovering from a stroke.
Oh, wow.
Or, a major surgery like a hip replacement. I mean, those are huge life events.
Right.
And the thought of being able to, recover in your own space.
Yeah.
Where everything is familiar and comfortable.
Totally.
I mean, that's got to make a difference, right?
Oh, absolutely. And there's actually, there's a lot of research now that shows that when you recover in a comfortable, familiar environment, it can really reduce those stress hormones.
Wow.
Which in turn can actually speed up healing.
Wow, that's amazing.
Yeah, it's pretty fascinating.
It is. And this isn't just for, older folks. This is for anyone, really.
Hey.
Regardless of your age. If you need that little extra boost during recovery, this could be a good thing, right?
Yeah, absolutely. So, it could be a young athlete who's recovering from a knee injury, for example.
Right.
And they could be doing their rehab at home with the help of a professional.
Right. So convalescent care is really about...
It's about meeting people where they are in their recovery and giving them that support to get back their independence.
I love that. Okay, so let's get into Medicare Hub Limited and their approach to all this.
Sure.
I'm seeing that they offer a really wide range of services. Yeah. It's almost like they're building you a personalized package.
It is. And that's what really makes them different from a typical home health aide.
Right.
A home health aide might be great at certain tasks, but they may have a more limited scope.
Right.
Whereas Medicare Hub Limited, they really focus on personalizing the care plans.
Interesting. So it's all unique to the individual.
Yes.
I love that. Okay, so let's say I'm someone who is recovering from surgery.
Okay.
What might my care plan look like?
All right, well, picture this. You've just had surgery. You're back home. You're probably a little groggy.
Yeah.
A little overwhelmed.
Oh, for sure.
So a care coordinator from Medicare Hub Limited would actually come to your house.
Oh, wow.
And have a chat with you.
Okay.
Not just about your medical needs.
Right.
But about your lifestyle, your preferences, and your goals for recovery.
I love that they're really taking the time to understand the whole picture.
Exactly. It's not just about checking boxes.
Right.
It's about really creating a plan that fits your life.
That's fantastic.
Yeah.
So from there, what might they include in the plan?
Well, it could be anything from medication reminders, especially if you're on pain meds or if you have a complicated schedule. Yeah. They could also provide help with, everyday things that might be hard after surgery.
Right.
Like bathing or aggressing or even just, getting to the bathroom safely.
It's funny how we take those things for granted when we're healthy.
I know, right?
But then when you're recovering, they can be such a hurdle.
Exactly.
Like I'm picturing someone who can't bend down to tie their shoes.
Yeah.
Or needs help getting in and out of the shower,
right,
having that extra help could make a huge difference.
Oh, totally.
And then there's also just having someone there to talk to,
right,
to encourage you, help you feel less isolated.
That's important.
Because I imagine that can happen during recovery.
Yeah.
And that's just as important as the physical stuff.
Absolutely. It's all about treating the whole person.
Yeah.
Not just the illness or the injury.
Totally. And if you're someone who lives alone, or your family can't be there all the time,
right,
it must be a huge relief to have that.
It is. It gives peace of mind.
Yeah.
Both to the person recovering and their loved ones.
So I'm curious about like chores and meal prep.
Yeah.
Do they have people who specifically do those things?
They have a team of caregivers with a lot of different skills.
Right.
So some might be better at helping with personal care. Others might be great cooks.
Right.
Or really good at keeping things organized.
So it's like a customized team.
Yeah.
Working together to make your recovery as smooth as possible.
Exactly.
I love that. All right. So say someone listening to this thinks, wow, this sounds amazing.
Yeah.
I could really use this, or, my mom could use this.
Right.
Or like my neighbor who just had surgery. What's the next step? How do they get in touch with Medicare Hub Limited?
Well, from what I've seen, they've got a whole team ready to answer questions and walk people through the process.
Great. And I'm guessing they work closely with healthcare providers.
Absolutely.
Because that transition from hospital to home is so important.
Yes. So they really emphasize that collaboration with the doctors, the nurses, social workers, physical therapists, anyone who is involved in that patient's care to make sure that transition back home is, smooth and supportive.
Yeah.
And they even work with the insurance companies to help with the coverage and benefits.
So they're really taking a very holistic approach.
They are. I love that.
Yeah, it's impressive.
Yeah.
Yeah, it really shows how healthcare is changing.
Right.
It's not just about the hospital anymore.
Yeah.
It's about bringing that support into the home. Totally. And that can be huge for people.
Absolutely.
So we've been talking a lot about, the good stuff about convalescent care. But what about the, potential downsides or challenges?
Right.
Because there have got to be some, right?
Oh, for sure. It's always good to look at both sides.
Right.
And you're right. There are some things to consider.
Okay.
One that comes up a lot is cost.
Okay.
Depending on, your insurance, what services you need, how long you need care for.
Right.
It can sometimes get expensive.
That's a real concern.
Yeah.
Especially these days.
Yeah.
So how does Medicare Hub Limited, how do they approach that?
Well, they seem to be very upfront about their pricing.
Okay.
They offer free consultations.
Okay.
So you can talk about your budget, see what your coverage options are.
Right.
And they really try to find ways to make it work.
So they're having open and honest conversations about cost from the beginning.
Yes.
Yeah.
Exactly.
That's good. Because I know a lot of people get surprised by healthcare costs.
I know.
So it's good to have that all out in the open.
Right.
But even with a company that, seems to work with people on costs, isn't access still an issue?
Yeah.
I mean, there are people who just can't afford these services.
Absolutely. And that's, a bigger issue that needs to be addressed.
Right. Yeah. It's not just about one company's policies.
Exactly.
It's about making sure everyone can get the care they need.
That's right.
Regardless of their finances.
Yes.
Yeah. That's a tough one.
It is.
No easy answers there.
Nope.
Okay. So let's say someone can afford the services.
Okay.
Are there any concerns about, like, the quality of care at home versus, in a facility?
Right.
How can we be sure someone's getting the same level of attention and expertise at home?
Well, I think it's really important to do your research.
Okay.
Don't be afraid to ask tough questions.
Yeah.
Like, what are their hiring practices? What kind of training do their caregivers get?
Right.
What happens in an emergency?
Yeah.
Are they licensed? Are they insured?
Okay, so it's like any other big decision.
It is.
You're not just jumping in.
Right.
You're doing your homework.
You got to do your homework.
Checking reviews, credentials. It's good to be thorough.
Yeah.
And I imagine word of mouth is important too, right?
Oh, absolutely. Talk to your friends, family, your doctor, see if they have any recommendations.
Yeah.
Get as much info as you can.
Okay, so you've chosen a provider.
Right.
But it doesn't stop there.
Right.
Stay involved.
You do.
It's not hands off.
Right.
You're part of the recovery process.
Yeah, so open communication is key.
Okay.
Stay in touch with the care team. Ask questions.
Right.
if you have concerns, speak up.
Yeah.
It's a partnership.
Right.
It's not just a one-way street.
Okay, so we've talked about the cost, about vetting providers, and about communication.
Right.
Now I want to kind of zoom out and look at the bigger picture.
All right.
Technology is changing everything.
It is.
Including healthcare.
Yes.
So what do you think is the future of convalescent care?
Oh, that's a fun question. I think we're already seeing technology play a role. And I think convalescent care is ready for more.
Right.
We have telemedicine now, connecting patients and doctors.
Yeah.
We've got wearables tracking your vital signs, apps to remind you to take your meds.
Yeah.
And I think that's just the beginning.
I'm picturing those technologies getting even better, more personalized. Imagine an app that not only reminds you about your meds,
right,
but it tracks your pain levels, your mood, and maybe even suggest exercises based on how you're doing.
Wow.
It's like a little virtual care companion.
That's cool, right? Your pocket. And think about what AI could do.
Yeah.
It could, take all the data from your wearables, your medical records, even your social media.
Wow.
And create a recovery plan that's really tailored to you.
That's amazing.
All right, like a super smart health coach.
That's what I'm talking about.
Yeah.
But it's not just about gadgets and algorithms, right?
No, definitely not.
It's about using that tech to improve human connection.
Yes.
So, what about virtual support groups?
Yeah, great idea.
Where people going through similar things can connect, share tips, encourage each other.
Absolutely.
And maybe even combat that feeling of, isolation.
Right, because that can be tough during recovery.
Yeah.
So important.
And what about virtual reality?
Oh, yeah.
For immersive experiences that could help with healing. So someone recovering from a stroke could use VR to practice everyday tasks.
Right, in a safe environment.
Yeah, and someone with anxiety could use it for calming nature scenes.
Exactly, or meditations.
So we're talking about taking recovery to a whole new level.
Yeah, it's not just about the physical stuff anymore.
Right, it's about the whole person. Mind, body, spirit.
Exactly.
And then there's robotics too.
Oh, right.
For things like mobility support.
Okay.
Or even companionship.
Like a robot friend.
Yeah, imagine that.
That'd be cool.
A robot that helps you get out of bed.
Yeah.
Reminds you about your meds. And even plays music for you.
That's awesome.
It's not about replacing human care.
Right.
It's about making it even better.
Yeah, I like that.
We've gone from helping with daily tasks to AI and robots.
It's amazing how fast it's changing.
Yeah, it's mind-blowing how tech can transform convalescent care.
It really is.
But with all this innovation, we got to be careful, right?
Oh, yeah, absolutely.
There are potential downsides.
Of course.
We have to think about things like data privacy.
Right.
Algorithmic bias, making sure everyone has access.
Exactly. We don't want to create a system that leaves people out.
Right. It's about using tech responsibly to make people's lives better.
And make recovery better.
Yeah, and make recovery as positive as possible.
Absolutely.
So we're wrapping up this part of our deep dive.
Okay.
And I want to bring it back to our listeners.
Yes.
We've explored what convalescent care is, how it works,
right,
the benefits, the challenges.
Yeah.
We even looked into the future a little bit.
The future's exciting.
It is. And we want you to come away from this feeling empowered, not overwhelmed.
That's important.
Convalescent care can be confusing.
It can.
But we hope we've shown you that it doesn't have to be.
Right.
It's about knowing your options.
Yeah.
Speaking up for what you need. And using the resources that are available to support you or your loved ones on the road to recovery.
That's what it's all about.
So, as we wrap up this whole deep dive into convalescent care, I'm thinking about how has the idea of convalescence itself changed over time as technology has evolved and as we've learned more about healing and all that.
Right. It's interesting, right?
It is. It feels like we're on the edge of something really big.
It's true. I think what used to be just about the physical part of recovery in a hospital, it's now so much more than that. It's about mental, emotional, even spiritual well-being.
Yeah.
And it's happening more and more at home.
Exactly. That's a huge shift.
It is.
We talked about telemedicine and AI, but I'm also thinking about things like personalized nutrition plans.
Okay.
Delivered to your door.
Oh, right.
Virtual support groups.
Yeah.
that connect people all over the world. Maybe even like VR experiences.
Oh, wow.
That can reduce stress and help you heal.
Interesting.
It's like convalescent care is becoming this like holistic approach.
Yeah, I like that.
To recovery. That's just part of everyday life.
I think that's really exciting.
It is. And as these technologies become more affordable and easier to get, more people can benefit.
Absolutely. That's the goal, right?
Yeah. No matter where they live or how much money they have.
Exactly.
That's pretty amazing.
It really is.
It makes you think, like, what else could happen with at-home recovery?
Yeah. What's next?
Could we see, like, robots?
Oh, wow.
That help with physical therapy.
Okay.
Like guiding your movements.
That's cool.
Encouraging you.
And what about AI companions?
Right.
That not only remind you about meds, but can actually like talk to you.
Yeah, engage with you.
Keep your mind active.
And help with loneliness.
Right. That's important.
The possibilities are pretty incredible.
They are. It's amazing.
We've gone from basic help to AI and robots.
It was a huge leap.
It really is. And it's all happening so fast.
I know. It's hard to keep up.
Yeah. But we're definitely moving towards a future where healthcare, technology, and just like daily life are all becoming more connected.
I agree.
And that's super exciting.
It is. But we have to be careful, right?
Oh, for sure. There are, ethical things to think about.
Right.
Like privacy, bias in algorithms.
Yes.
And of course, making sure everyone can access these things.
Absolutely.
So it's on all of us, really.
It is.
As listeners, as patients.
As, members of society.
To make sure these advancements are good for everyone.
That's right.
Not just a few lucky people.
Exactly. That's the key.
We need to be informed.
Yes.
And part of the conversation.
Absolutely.
So as you go about your day-to-day, I want you to think about this.
Okay.
What would your ideal convalescent care look like?
Interesting question.
What should technology do?
Yeah.
What values are most important? Right. Because the future of recovery is being shaped right now.
It is.
And we all have a part to play in that.
We do. We can all make a difference.
That's a powerful thought.
It is.
Thanks for joining us on this deep dive.
Yeah, thanks for having me.
We hope you learned some things.
Learned a lot.
Got a new perspective.
Absolutely.
And maybe even had a few aha moments.
Those are the best.
They are. But this isn't the end of the conversation.
No, not at all.
Keep learning.
Yeah, keep asking questions.
And keep speaking up for what you need.
For yourself and for your loved ones.
Exactly. All right, until next time, stay curious.
Stay curious.
And take care.
Bye, everyone.
We hope you enjoyed this podcast. Please visit our website to learn more about our services at medicarehub.co.uk. Bye for now.